Hello, everyone, and welcome to the Broad Street Workshop session, Data Hunt, Food Insecurity in America. My name is Tracy Flood. I'm president and co-founder of the Broad Street Institute, and I'm really excited to be welcoming you all here today. Now, here in this room, there are lots of people who are engaging in the workshop, and we also have people joining us with a follow along or video only option. So if you're watching this video afterwards, hello. If you're here in the room, thank you so much for making the time in your schedule to be here. We're really excited to have you here today. Honestly, thank you. All right, today we're going to be building a portfolio project, creating a data visualization. A template will be provided. Actually, a couple different templates will be provided for those who are joining us for the data challenge. First of all, let's start out with our main objectives. So to successfully complete this data challenge, we're going to be making an infogram using the phrase 1 in 8 households rely on SNAP for your community of interest. Now, we recognize that in your community, it might not be 1 in 8. So you'll select your community of interest, and then you'll find that number, 1 in 8. So it might be 1 in 12, it might be 1 in 3. We don't know. And so let's find out together, and then we're going to make and put this information into an infogram, and you'll get to choose your template from one of the ones that's scrolling in the screen right now. Our learning objectives today. By the end of the data hunt, we're hoping that participants will be able to understand the data ecosystem of publicly available data on food insecurity and proxies of food insecurity in the United States. After the data challenge, for those who are staying for the data challenge, we're hoping that participants will feel comfortable and confident querying, collecting, and calculating 1 to 3 indicators from at least one data source. The data source today is going to be Census Reporter, and then we'll be creating that visualization for a target audience. We're also hoping that we meet the objective of connecting. That's our bonus objective today. This is an interactive session. If you're watching the video, our hearts go out to you. Those who are here in the session, the connecting is such an important part. Hopefully you're able to see others who share your common interests, connect with others, strengthen those networks, and then we can all have stronger voices together. We're going to start out with some disclosures. Broad Street is a registered 501c3 nonprofit. We are a learning community, first and foremost. We're training the next generation of leaders in data-guided decision-making and evidence-based solutions for improving public health. Our funding is 100% from our learning community and specifically from our internship community. This event was requested, planned, and supported by learner volunteers within that community. So a huge thank you and shout out to them. Here at Broad Street, we believe that data heal the world if we share it. We feel very strongly in the power of data to bridge divides and to bring people together towards shared common solutions. We want data to be shared. Please consider sharing anything that we do here on social media. And if you're able to, also feel free to send it off to your policymakers. Why not? Feel free to shoot them an email and let them know what you think. If you end up reaching out to policymakers, then we have a little bit of a disclosure around civic education. There is an option to take the infogram that you're going to be making and sending it off to policymakers. We are doing this in a style that is nonpartisan, non-lobbying education. So if you're at a work site that currently limits lobbying, it should be safe for work. Now, this is only one option, so you might also be able to take a different path. We hope everyone considers reaching out to the policymakers. With that, I want to say a very warm welcome to each and every one of you. Super excited to have you with us today. Let's start with today's objectives, give you a little bit of background about us so you've got some context as why we're doing this, and then we want to share a little bit about you. Our ground rules are to spread hope and to share solutions. We know that there's a very challenging landscape out there for public health currently, and also for different funding sources as well. We recognize that. We also recognize that spreading despair and snark isn't particularly impactful, powerful, or empowering. And we really want to be sure that we're empowering those around us and we're spreading paths forward, essentially. So please join us in those ground rules by spreading hope and sharing solutions. I want to share a little bit about me so you know the perspective that I'm coming from. I live currently in Milwaukee, Wisconsin, and I have over a decade of experience in community health data visualization. I'm president and co-founder of the Broad Street Institute, and I have designed large-scale software platforms, including food reports for the nation. And I've written community health needs assessments as well for nonprofit hospitals. Love data, love sharing my love of data with others because I strongly believe that data bridges divides and is the key to solving this generation's greatest challenges. I truly, truly believe that. I also strongly believe that data heal the world, and I'm very fortunate to be surrounded by many others in this learning community who share the same beliefs. And of course, what we mean by this is that data people heal the world. We find that data people approach things just a little bit differently. They have tools at their disposal for being able to look at the world with a slightly different view, maybe a more objective view, but maybe with a blend of that objective and subjective. So we really treasure those who are aspiring to be data people because we believe that they bring a very unique perspective and they bring data to the table and to the conversation. So that's why us, why you, and why now. So, one of the reasons why we're bridging this topic now is because the single stat of 1 in 8 Americans rely on SNAP was a very, very powerful indicator for the national conversation during the government shutdown. So, we believe that this is a very timely topic, even though if you're working in the field, you know that this has been a challenge ongoing and within the United States. We believe it's come into the national conversation recently. All right, data hunt speedrun. We are going to do the data hunt speedrun. That is where we are. Let's do it. Data hunt. Do. Data hunt speedrun of the resources. We're going to start with our big picture goal. We're going to do why food insecurity, and then we're going to dive into the resources. We've got 10 minutes to do this, and I think we can accomplish our goals. Let's go. All right, big picture goal. Why are we doing this? We believe that by sharing community health data and raising awareness of the availability of publicly available data, and hopefully increasing numeracy along the way, then data will be more likely to join the national conversation, to be present on social media, to be present in the inboxes of policymakers. We really believe in data advocacy. And we believe that advocating for health through the use of data will ultimately lead to evidence-based policies that promote health. We strongly believe in this. That is our big picture goal. And we're hoping in the end, it'll cascade into a healthier nation for all. This is a hope that we have, a vision that we have. And why have we chosen the topic of food insecurity? So food insecurity is what it can be considered as an upstream health indicator. There is a high level of evidence currently that food insecurity is associated with downstream health outcomes like food patterns, diets, and also really long-term outcomes like depression, anxiety, diabetes, obesity, and cardiovascular disease. All of those cascade towards preventable causes of premature mortality, which is why we're interested in it. The Congressional Health District Dashboard does a great job of explaining why food insecurity is so important, and that's a resource for that. Another great resource that outlines how food insecurity is a social determinant of health is the County Health Rankings and Roadmaps. They have a logic model where power, societal rules, like policies, cascade into the environments around us, our social and economic factors, the physical environment, the built environment, and the health infrastructure that we have around us, like clinical care and health behaviors. All of that cascades down into a long and healthy life, or a life that is a little bit shorter because of a non-optimized environment and policy environment. Data hunt. So let's talk about the ecosystem of publicly available data here in the United States. So the way that the data essentially works is there's groups that generate the data, and there's also groups that curate the data. So for those that generate or collect the data, either through a survey or through a built environment assessment or something like that, we've got the sources of data here. You also have curators of data. A lot of times they have curated really careful indicator lists, County Health Rankings and Congressional Health District Dashboard through the University of Wisconsin and NYU Langone, respectively. They have really tightly curated an indicator list of things that are associated with downstream health outcomes. The CARES Map Room is probably hands down one of the best sources of curated data. Not curated data, it's all of the data. It's all of the data. Whenever I'm doing a data hunt, I actually always start with the CARES Map Room. But these curators, what they're doing is they're collecting data from all of these other sources So the sources of data feed into the curations. American Community Survey, let's actually start there. A lot of you have used data.census.gov. Few of you use Map Meal Gap. So let's dive in. Let's do a speed run. All right, American Community Survey. We're actually going to be using this indicator today on Census Reporter. Census Reporter is a download of the American Community Survey. They download it every year. It's a really amazing and rich source of data. It shows you how the American Community Survey, conducted by the US Census Bureau, organizes their data tables, and then you can get tons of data for your community. So if I just wanted to say Milwaukee, for instance, then I can choose Milwaukee, either the county or the place, the city, and then get totals. This is the tip of the iceberg. Census Reporter has really amazing data sets. I really hope you do take the time to explore this. They've got these amazing community profiles. All right, next one. Map the Meal Gap. Map the Meal Gap in Feeding America is a very well done dashboard, thinking very carefully about where the gap is in the funding for food benefits programs and the receipt of food benefits programs. So where is the need high and maybe not being met? So you can zoom into a single state. You can then zoom into a county and also possibly a city as well. And they'll give you the food insecurity rate overall. And then they'll tell you where there might be a gap in funding, including the budget shortfall as well. So they've really carefully curated this. And if you're ever talking to an elected official, it's designed for that purpose. It's designed for that purpose, to advocate for funding. They've done a very nice job of thinking really carefully about what tools and resources are needed to enhance funding in communities. You can do it by congressional district. You can do it by different races and ethnicities and different ages as well. So a very rich data source. Okay, next one. Map the Meal Gap, the Places Project. The Places Project is a small area estimates program of the behavioral risk factor surveillance system, and it has a ton of really cool indicators at very, very small geographies. And so right now I'm actually going to go to health-related needs. I'm going to go, okay. Then you have food stamps here. This is self-reported food stamps, and then food insecurity as well. So you can see that not all states participate in this part of the behavioral risk factor surveillance system. So they're not able to do small area estimates in some states. But if I were to zoom in, and I really zoom in, the further I zoom in, the more detailed the map becomes. And I can do the overall estimates for Milwaukee, but I can also see the data by census tract. This is a very, very small geography that splits up counties, as census tract does. So like, look how detailed that is. If I was wondering where to put resources, I'll tell you what, this helps a lot. This helps a lot. All right, thank you, Places Project. All right, school lunch program. The school lunch program by the National Center of Education Statistics, Common Core of Data. This is, sometimes you'll see how many children in a community are eligible for free and reduced lunch. They have a really amazing data set for download, but actually I think the best way to visualize their data is in the CARES map room. So hang on tight to that one. We'll look at it in the CARES map room. All right, the Food Access Research Atlas published by the United States Department of Health and Agriculture is available. This was not working for me earlier, so I'm just going to click on it and hope it loads. Nope, but that's okay. A lot of the data that is published here is, if it works for anyone, let me know. A lot of the data that are published here are also available in the CARES map room. I've mentioned the CARES map room a couple times now. Let's dive into that. The CARES map room is probably the most underappreciated, most kick-ass source of data on the entire internet. And it is through the University of Missouri Extension Program. They have a group that specializes in mapping. And honestly, if I'm starting a data hunt, this is where I start. Hands down where I start. Even before I go to Google, I will go here. So the CARES map room, you can see that you can browse by topic. Look at all of these topics. They have curated this over years and years and years. And so they actually have, so if I can find food, they actually have data on a ton of stuff. Food, access, locations. They have it over time, which is really unusual for dashboards to have it over time. Usually they simply showcase the most recent one. And look at all of this. So the USDA data that I was talking about is curated here. And you can put it on the map. You can put lots of other things on the map. You can do tons of stuff. And they also provide very, very small geographies at the census tract level. Now, in order to see this, I need to go to the legend. And then I can start to see it. I can zoom in. Snap authorized retailers. I can adjust the opacity here. This is just an amazing, amazing resource. It's the best collection of data I've ever seen. Totally underappreciated. I think only one of you has said, I think that one person was me when I filled out this survey. Please use the CARES map room. It is awesome. All right, and they also have information on each of their indicators. So if you want to go to the original source, you can. They'll list the original source, then a hyperlink to it, and a little bit more information about the background. All right, now it is common for publicly available data to have delayed release years. That's completely normal. We assume that things don't change so dramatically or so fast that something from 2 years ago is no longer valid. So just know that for publicly available data. Boom, CARES Map Room. Many of you have used the county health rankings and roadmaps before. Amazing data sets, but don't forget that they also have what works for health as well. Because so many of you have used it before, I'm going to skip over that one. I'm going to go to the Congressional Health District dashboard. This one is really, really awesome if you're talking to somebody from the House of Representatives in DC. And the reason why I really like this is because they've carefully curated, similar to the county health rankings, a map of different indicators and then calculated them at the congressional district level. So a very, very cool resource, very beautiful. You can see it's not available for all states because guess what? This is the data curator and they're using the places data set for this. Let's make sure that that's true. Yep, source places project. Remember, this is a curator of the data. They're bringing in data from those original data sources. All right. If you have additional resources, we recognize there's a lot of experts here in the room. Please feel free to add it as a comment here. Please feel free to share them here. You can even share them in the Zoom chat as well. Happy to always share resources, whether they're a curator or whether they're a collection of data. Feel free to share those. All right, and that's my time for the grab and go portion of this session. If you were just hoping to get a ton of resources, here they are. Good luck with grabbing them, and we're going to be shifting gears now to the next part of the session. And now we are here on the part of the data challenge. Just revisiting our learning objectives and seeing where we are at. So by the end of the data hunt, participants will understand the data ecosystem of publicly available data, the collectors, the curators. Hopefully we've done that now. Now we're going to be doing the data challenge. During this data challenge, we're going to be learning and actively querying, collecting, and calculating indicators from at least one data source. It's truly one indicator, which is percent of households receiving SNAP. We're going to be looking at number of households, percent of households, and a rate of households, hence the 3 indicators. One data source, census reporter. And then we're going to create a data visualization. All right, so let's talk about a little bit of the story before we dive into making this. We're going to be making an infogram, which we hope that everyone will consider sharing on social media. I, myself, hesitated for a very long time sharing things on social media. I love data. I love sharing information. I love sharing things. Why did I wait so long to share things on social media? Well, I was reminded of why I waited so long to share things on social media when I posted something on social media, and I was so proud of it. And I triggered a troll farm that then something in the hashtag that I had triggered a troll farm. And I was like, oh, this is not a safe place to be sharing my data. And then I realized that that was the point of the troll farm. It was to drive people away who were talking about public health, who were talking about data. So once I sort of got my wits about me and realized that there are forces in this world who don't want you to share information and data and don't want you to advocate for public health. And we really have to do it anyway. Now, sharing data can actually be very scary. I love data so very much, but I know whenever I post something about data, maybe I've said the phrase wrong. Oh, it's a ratio, not a rate. Oh, you actually calculate it this way. Or maybe the WHO calculates it this way, but the CDC calculates it this way. Or maybe there's some small terminology or citation differences that other people would do. I get it. Sharing data, there's always room for improvement. But I sort of see data and the data space as a little bit like music, where there's no perfect piano recital. There's always room to improve. And the only way to improve is to practice and to grow and to try. And I admit that I sat on my hands for a really long time and hid in my little data shadows, enjoying the data, but not sharing it with anyone. And I was honestly, that was cowardly. I wish I hadn't done that. And I was so relieved when I just started to get in the habit of sharing data knowledge with others. People might say, oh, you didn't say the rate correctly. That's okay. Thank them for their input. Learn from that experience and that feedback. It's a process. No one is perfect at data. It is like music. Data are vast. The data field and different survey availabilities is also vast. The field of public health is incredibly vast. Every code book is different. There's no way to know everything. So why are we trying to know everything before we share our information? I don't think it's necessary. I think we can give it a try. I'm hoping you don't hesitate the way I did, and that's what I wanted to share with you, because we're about to make an infogram, and we do hope you share it on social media, and we'll cheer you on as you do. Let's go step-by-step, watch and learn. We're going to start with the main objective. We'll revisit it, and then we'll make sure that it's a smart objective. We're going to talk about our inputs, our inventory, what do we have in our toolkit, and a timeline. We're going to action map it and then do the step-by-step walkthrough using the big spreadsheet. We've got a spreadsheet alert coming your way. The data challenge. The main objective is to successfully complete this challenge. Create an infogram using the phrase 1 in 8 households rely on SNAP. Now, it might not be 8. I'm obviously going to have to define my community. The community can be anything. It can be my county, it can be my state, it can be my legislative district, lots of different things. So yeah, you'll have to define your community and then find the number for your community. All right, that is the data challenge today. Is this a smart objective? Is it specific? Yes, and it's an infogram with one indicator. Measurable, yes, we're going to measure it. And the challenge tracker, I've got to share what I've done in the challenge tracker. We think it's achievable in about 20 to 40 minutes. 40 minutes if you hit a little bit of a roadblock or want to log in and create a Canva account, but it is achievable. Is it relevant? It is aligned with our big picture goals for a healthy nation. And who is responsible? Everyone's responsible for their own infogram. We're responsible for supporting you through the process with our support squad. Is it time bound? Yes. Obviously, we have this session, but the actual challenge ends midday on Thursday. So we've got the 90-minute workshop. We've got a 3-day time span with which to finish this 20 to 40-minute project. The team is you, it is me. Resources are 0. This is totally free. Even with Canva, Canva's pro account for nonprofits is free. All these data sources are free. Zero money spent. Then tools. We're going to use the G Drive folder. We're going to use Census Reporter as a tool. We're going to use the challenge tracker spreadsheets. You'll see it in just a second, and also free Canva account. The 3-day challenge has already started. You've got Wednesday to tinker and to try it out some more. And then Thursday, if you're able to share your infogram with us, with others, then let us know by midday Thursday. And that's when our team loops back into the challenge tracker to see how everyone is doing. Anyone who has completed the challenge by midday Thursday is awarded a certificate. It's kind of a micro certificate for a micro task, but it's a very real certificate sent via email. 3 days total. All right, let's action map this. Action map to the main objective. What are the little pieces of the puzzle that we've got to put together? First of all, we try to do human-centered data design here. What does that mean? I'm a human, but I might find a lot of data very, very interesting. What is the data for exactly? Who am I talking to about the data? Am I talking to policymakers? Am I talking to a policymaker who has low numeracy or maybe has high numeracy, which means high data literacy, but no time? So they need something fast, and we need to get to the point very quickly. Or am I talking to, if I'm a professor and I'm talking to a class and they want to explore it and kind of do a deep dive and look at all of the different regional and age disparities, then that's a different audience. So let's just take a moment to think and put in your mind's eye, who are you going to be sharing this data with? There's no such thing as the general public. The general public does not exist. Even if you blast it on social media, those who will see it will be your followers on social media, which would be very cool. But it's not the general public. It's always a niche of the world, right? All right, so know your audience and your geography. Okay, who are you sharing this data with? What geography are they interested in? If I told each and every one of you the rate in Wisconsin, are you going to care? Maybe one of you will care. I'm going to care. But it's a really big geography. What are they supposed to do with that information if it's not their state? Okay, so what geography are is your key audience member the most interested in? So think to yourself who you're sharing this with and what geography they would find most interesting. Now, I really encourage you to narrow down your audience. If you're like, oh, I'm sharing it with my social media, so surely I should just say the entire United States because it could encompass the entire United States. That's fine, but we are going to be flexing our data muscles, so feel free to narrow in on your county of interest, your city of interest. Okay, and then what would they find most interesting about the data? We have predefined a little bit that we think that that 1 in 8 metric was very, very powerful, similar to what's been reported. So we're going to envision that 1 in 8. All right, so what presentation of the data would they find most interesting? We want to take that and then put it into our template. So we really want to design the template rather than going and finding all of the data that's possibly available. We really want to think what's the least amount of information that we could say to have an impact and design our template around that. And then we want to collect the data. We're going to go on a data hunt and we're going to find those indicators. And in particular, for this deliverable, we're going to ask, can we find the percent of households receiving SNAP for my geography or the community of interest? And how do I calculate that phrase 1 in 8 households? All right, this is our human-centered, design-first approach to data. Thinking about the audience, what information they would find most interesting, how do we present it in a way they can digest it in, and then we go and collect the data. It is iterative. Maybe the data that they would find most interesting don't exist. We might have to loop back around. If we're confident in what we're finding, then we can add data to the template and complete the infogram and share the infogram and successfully complete the challenge. So let's start with knowing your audience and their geography of interest. Prep the template with no data. First, collect the data and then add the data to the templates. Those are the steps. Let's go. All right, here we go into the challenge tracker. All right, I did give a spreadsheet warning. Observe, behold the spreadsheet. This spreadsheet, let me just do a little bit of a tour before I dive in. It starts here when you claim a row. You won't claim your row yet until you have a team room. Once you've got a team room, then feel free to add your name and don't forget to push enter. All right, that's once you're in a team room so that you can put your name in your team room. That sounds great. Not me, not Tracy. New person. New person will go into team room 3. All right, so I'm going to claim my room here. I'm not in a breakout room currently. Now I get to select a target audience. I can select it from the drop-down list. We are sort of trying to encourage people to reach out to policymakers, but if I was interested in talking to my mayor, then it does recommend a geography for that person. I don't have to do that geography, but I will. Why not? Place, city, village, or town. Then I'm going to select my state, which is going to be Wisconsin. And I did promise I would give an overall tour of the data, and I just sort of dove right in. So it does start with the target audience, and then it goes to selecting a geography of interest, and then it goes into the metric, the data hunt challenge. We're going to be collecting 1, 2, 3 indicators, and most importantly, the percent of households receiving SNAP can also be calculated from the total number of households, the number of households receiving SNAP versus the total. So this can be calculated, it can be collected. We're going to compare it to the benchmark. And is it high or low compared to the benchmark? And then here there's a calculation. Honestly, you just take 100% and minus that percent, and then you get that 1 in 11. That's what you do. That's how you get it. And you can see that little calculation here. All right, so retreat. All right, so then don't forget to cite your data sources. The idea with sharing data is that you want, as much as I'd love to be like, just take my word for it, you actually want to empower others to find these metrics for themselves in their own community, or to check your work as well. I mean, why not have full transparency and start the conversation? So always, always, always cite your data sources. It should be cited well enough that people can follow what you found. if they're like, hey, this number doesn't match what I found, you're like, did you check the year? Maybe the year is different. Maybe the estimate range is a slightly different year. So always cite your resources, and that's helpful. All right, data progress. This is where you declare, I got it, I've got the data, and then you can select your infogram. I'm peeling through this and I'll loop back with the data in just a second. All right, so here in Canva, you'll be able to find this, and those with a Canva account can do a file, make a copy. If you don't have a Canva account, feel free to have others make a copy, choose your favorite design, and replace the number here with your number, replace the in the United States with your community of interest, and let's then grab the link when you make your own copy, and then share your link here, then says, yay, I did it. Okay, I sped through that. If you are attaching this infogram to a letter, then feel free to also include a salutation to your mayor, for instance, and share with them this information. This is designed to be in the style of non-educational lobbying, and it really is just informational, and you can always ask what their thoughts are and their opinions are and what their actions will be. All right, so back to data. Let's do this step by step now. That was just a little bit of an overview fly through. All right, mayor, city, village, town in Wisconsin. I'm going to name it Milwaukee, Wisconsin. All right. I really want to get the 5-digit FIPS from Milwaukee, Wisconsin. A FIPS code is a unique geographical identifier, and I'm going to grab this actually from Census Reporter in just a second. Census Reporter, copy and paste this link into there. All right, so this Census Reporter quick link is actually designed to be preloaded with the United States and the state that I just selected. I'm going to add in my geography, Milwaukee, Wisconsin, the place, the city. All right, so Milwaukee, right now it's a 1-year estimate. That's notable. And I'm going to grab, you can see the percent here of households receiving food stamps or SNAP in the past 12 months. And also I can switch to totals and see the total number here. All right, I did say I was going to grab the FIPS code. I think the FIPS code is this, but actually I'm just going to Google the FIPS code of Milwaukee. This is only important if you're going to be trying our bonus challenge, which is the webhook. Yeah, I do need 5-digit FIPS. I think that the 5-digit FIPS is actually up here. All of these quick links up here are very, very helpful. All right, I think it's 53000. All right. I know if that's right or not. 53000. It should be 5-digit FIPS. Yep. Starting with the state. Yep. Okay. All righty. Next one, number in SNAP. Let's grab this number from here. I'm just going to copy and paste it. Boom. Boom. All right, total households. This one's a little bit tricky in Census Reporter because they have this one up here and then they have this one down here, households that did not receive SNAP. Theoretically, I can just add the two together, but I can also just go straight to the percentages as well. So 80.2. So I'm going to skip over this one and do 80.2. I'm just going to remove the formula there and just go straight for it. All right, this is high compared to the benchmark, and you can see that 1 in 4 households in Milwaukee receive SNAP. This rate is high. All right, so this is the phrasing that I would use when I go to update my infogram. I'm going to pick the one that I like the best, and then I'm going to edit it. Now, if I edit the template, then it'll update for everybody. So instead, I'm just going to do a little for in Milwaukee. All right, so I'm just going to undo, so I don't mess it up for anybody else. All right, because I did not make a copy of this. All right, that's it. That is the infogram. Look at that. Half an hour mark on the dot. All right, so I'm going to, now this was a 1-year estimate here, 1-year estimate. So I do have to update this to 1-year estimate. There's 5-year and 1-year estimates from American Community Survey, and I'm going to say I got it. Woohoo! All right, and the rest we went over. We are here. Let's try it as a team. Team rooms are here.